My parents made me speak to a doctor. A shrink, he gave me this medication.
Do you know what it is?
Risperidone. I'm supposed to take it at night. I think they're just trying to distract me from my work. My sister went with me.
What was the diagnosis?
It was nonsense. He said psychosis or schizophrenia, something like that.
But you take the medication?
Here it is. Take a look.
Do you notice any difference in how you feel or act?
I don't know. Act? I don't know what you're talking about. I feel more tired and my hand shakes sometimes. Look. It's them trying to keep me from my work. I eat on my own now, just to be sure.
Tell me how you take the medication.
I put it in my mouth, I swallow.
So you are taking it every day?
Some days, I think. I think it's nonsense. It's just another way for them to dull my abilities.
Scott's family brought him to meet with a psychiatrist 4 months ago. The workup included an MRI with contrast, complete blood count, metabolic panel, thyroid panel, syphilis and HIV tests, and urine drug screen. All findings were within normal limits, except for marijuana on drug testing. In the absence of other findings, Scott was diagnosed with schizophreniform disorder based on the presence of delusions, auditory hallucinations, disorganized speech, and negative symptoms, including reduced emotional expression, anhedonia, and asociality. He was initiated on oral risperidone 2 milligrams per day, which was increased to 6 milligrams a day over 6 months. He was also scheduled for weekly talk therapy with a therapist who works with his psychiatrist.
Tell us about Scott's visit with the psychiatrist.
It seemed like such a victory to get Scott to see the psychiatrist. You really helped with that.
He seemed so bothered by the voices, and I told him a doctor might help and that I'd go with him if he wanted.
How has Scott's behavior changed since he saw the psychiatrist?
He put him on an antipsychotic. This is a few months ago. Honestly, I don't see much change. He sleeps more at night, so far as I can tell.
I would say he seems less agitated.
I think it makes him tired, and he also talks about that his hands shake, and I have noticed that his hands do shake sometimes. He also seems less expressive, like he has less facial expression.
How about his other behaviors, like the marijuana use?
I still smell marijuana all the time, so that hasn't stopped.
Actually, he ran out a few weeks ago, but he didn't want to leave the apartment to go get more. But that really didn't change his weirdness at all. I think he just slept less. Then that kid from high school came by and gave him more.
I never liked that boy.
Anyway, he says that it relaxes him, and eventually I got him to agree to leave the apartment by saying that we would go buy cigarettes. He told the clerk at the market that there were people watching him on the cameras and that he could tell if they were wired to another dimension with the others. And I don't know, I can't keep it straight between that and the government doing something. I think he was talking about the surveillance cameras at the store.
You all sound a little frustrated. What do you think is the issue?
We really wonder if the diagnosis is right. The doc said the medication should be doing something by now. Scott just doesn't seem much better.